Okay, so I was asked today to give a kind of current state of epidemiological affairs, particularly with Delta. And so here we go. Where are we right now? Can you guys see my notes or can you see my slide? You can see my notes. Okay. You would think after an entire 18 months of a pandemic, I would have this down. Okay. So and Anna, I think you can see the slides, right? Not my notes.
Yes.
Okay.
Yeah,
okay. So where are we right now? We are fully into our fourth wave of the pandemic. And interestingly and importantly, the pandemic is very spread differentially across the states. The South has been hit really hard with us here in Texas. And really recently, the Northwest has been starting to get really hard in the rural areas, as well as Kentucky and the Midwest, so South and North Dakota particularly. And unfortunately, this means in our hotspot areas that states like Mississippi, Florida, Louisiana actually hit the highest record of cases throughout the pandemic compared to previous waves. Thankfully, it looks like they've all really hit their peaks and they're starting to come down. But like I said, other areas in the states are starting to increase, specifically like the Midwest. Unfortunately, with an increase in cases among unvaccinated will come an increase in hospitalizations and deaths. It lags about 3 to 4 weeks. So I pulled up some charts on Florida. Florida hit their record of hospitalizations throughout the entire pandemic just recently. And they have also reached their record for COVID-related deaths in Florida. So why is this happening? So COVID is mutating every 2 weeks right now in the world. And unfortunately, Delta came to play, was first identified in India in 2020, December 2020, and really hit the States in May and June, and really taking care of all cases by the end of July in the United States. And Delta has been called the fastest and fittest variant we have seen. The World Health Organization said that. And it hasn't disappointed us, I guess, in that manner, because it has created this fourth wave for us in the United States. And Delta really changes the game. This is very different than before, very different situation we're working with. And this is because of a few reasons. One, Delta is 200% more transmissible. So this means it's more contagious than the previous variant, more contagious than Ebola, than polio, than smallpox, and as contagious as chickenpox. So on the average, one person that's infected will infect about 8 other people. So very transmissible. Also has 1,000 times the viral load. So people will test more quickly following exposure and will shed a lot more virus, specifically aerosol viruses. That's really changed the game. And they spread it for longer. Before Delta, the average infected person would spread it for about 13 days. And now with Delta, we're shedding it for about 18 days. So that means if you come positive, you just have more opportunity to infect others too. The other way Delta is changing the game is now it's transmissible among vaccinated. Previous variants vaccines, we got really lucky that they reduced transmission by about 90%. With this Delta variant, vaccinated people have the same viral load as unvaccinated, which means that vaccinated can still transmit the virus, specifically breakthrough cases. And so transmission is really only reduced about 20%. The interesting and really important thing is to notice these gray and red lines. The green and red lines. The green is vaccinated, the red is unvaccinated. As you can tell, the viral load is the same in the first couple days for vaccinated compared to unvaccinated. But then the vaccine really kicks into drive and recovers and fights this virus a whole lot faster than the immune system does without the vaccine. And we vaccinated people don't shed it as fast, and so we just can't contaminate as many people as unvaccinated. The other way Delta is changing the game is Delta is more a severe disease. We weren't really entirely sure about this, but have gotten a lot of data in the past week. One really important study came out in Lancet this weekend, showing that Delta patients had 2 times the risk of hospital admission compared to previous variants. We've also seen this in Singapore. Delta patients had a higher risk of needing oxygen, higher risk of going to the ICU, and even higher risk of death compared to other variants. And so this is probably explaining why our health systems, even in Harris County, are getting very overwhelmed right now. So what do we do about Delta? Number one is we have to wear a mask indoors. If you're vaccinated, you have to wear a mask too. Masks provide you protection, the wearer. It provides inward protection, but also provides outward protection for people around you. Fit and filter really matter with Delta. So N95 is the best. KN95 for kids is the best. If you can't do that, do a doubled mask, because cloth over surgical reduces exposure by about 83%. Knotted surgical mask, so what that means is look at C in this photo, provides about a 65% reduction in exposure. Loose fitting cloths really just don't protect that well. Cloth mask protection is low. What else does that mean? Delta mean is that we have to become more conservative with activities. If you have kids, if you have an immunocompromised person at home, you need to become more conservative. I put this figure together for my newsletter, but it shows the risk tolerance or the risky activities for kids, green being less risky and red being most risky. Before Delta, I always tell people I was in the yellow. I was traveling with kids in the airplanes. We would go to communal pools, etc. But now with Delta, I've moved to green. I become more conservative, and we're just really hanging out at playgrounds, maybe going to the farmer's market, really staying outside and away from indoors and crowded areas. The other thing that this means is it means we need to get vaccinated. A whole lot more people need to get vaccinated. Vaccines work. They continue to work against hospitalization and death. Out of 168 million vaccines or people vaccinated, we've had 9,700 breakthrough infections that resulted in hospitalization and death. The Kaiser Family Foundation looked on a state level that among hospitalizations, unvaccinated accounted for about 95 to 99% of their patients. So if we want to keep everyone outside the hospital, we need to get them vaccinated. Interestingly, and this goes back to my first slide, is that the states with low vaccination rates are seeing high hospitalizations, and the states with high vaccination rates are seeing low hospitalizations. It's quite apparent and quite obvious how well this is also working on a population level for our healthcare systems. Now, the more complicated question is, are vaccines working against mild and moderate disease still? They're doing okay, but the protection is waning. We saw a study, I think about 2 weeks ago, showing that against mild and moderate disease, the efficacy decreased from 91% to about 80%. So it still works, but not as great as it did originally against the Wuhan variant. So what do we need to do? It looks like we're all going to get third shot. We're going to get third shots. Boosters are very common with other vaccines, right? So in order to enter kindergarten, kids need 5 DTaP shots, 4 polio, 2 MMR, 3 Hep A, et cetera, et cetera. HPV needs a booster. Adults need tetanus booster. This is very normal. And this is because booster shots are most effective when they're at least 6 months apart. So we did our initial 2 doses very close together in the United States. We are losing about 3,000 people a day to COVID back when vaccines were available. So we gave the full protection, the 2 doses, about 3 to 4 weeks apart. But that sacrificed durability of protection. And so we need now a third one to help for the longevity of the immune response. A lot of people ask, what's going on in Israel right now? Cases are exponentially increasing, but they also are the highest vaccinated population. So what's going on? What's going on is we think it has partially to do with the waning of vaccines. The majority of the Israel population was vaccinated back in February. They were the first country to really hit hard with vaccinations. And guess what? It's exactly 6 months after that. And so we think that is waning protection. Just recently, Israel implemented a third booster shot, started in the beginning of August. 2 weeks later, after the third shot, we started seeing a decrease in cases among the vaccinated compared to the unvaccinated. So the third booster shots are working really well in Israel, and we hope that they'll work really well in the United States as well. Immunocompromised are already authorized for the third dose. The general public should be expecting a third dose come September 20th. It will be the same exact vaccine you got, before. It'll be for 18 and older and no mixing. So if you got Moderna the first two, you're going to get Moderna for the third. Unfortunately, sorry for my J&J folks, we just don't have really good data right now. We expect J&J people will need a booster come September 20th, but we're really still waiting on the hard data to see that. So just to, hit home, we're in a rapidly evolving environment. I think last time I came and talked to you guys is a very different situation than we are right now. Vaccines were high, rates were low back in May. Here we are in August going into September, and the game has changed with Delta. We need our masks back on, and we need a lot more people vaccinated. Come fall, we're going to expect boosters and hopefully peak. I think we've already seen our peak in Harris County this week, but as a state, as a country, see our peak here soon. Make it through the winter months, and then hopefully in April, if our variants don't escape our vaccines, then we should be in full control of this pandemic. So here is my contact information.